Good evening, ladies and gentlemen, and welcome to tonight's session of Ask Zak. And tonight we want to speak about diseases to look out for in this coming time, this next few months that's ahead of us. Now, just a very important note on this. These diseases that I'm going to talk about, they are viruses. And a virus, remember, no antibiotic works for a virus. The only reason why we sometimes give an antibiotic when any of the animals pick up one of these diseases is to prevent secondary infection. We want the body to fight the disease because that's the immune system's job, and we want basically the antibiotic, we want it to assist the animal if there is chances of a secondary infection. So that's the only reason why we sometimes give antibiotics when we talk about any of these diseases that's coming up. But remember, vaccination, that's the only way that you can actually prevent any of these diseases amongst your animals. So let's kick it off. First disease we're looking at is fowlpox. Now, fowlpox has already reared its head in quite a few of our areas that we visit a lot. Now, fowlpox is literally, if you look at your chicken, it's a virus that attacks your chicken, and it causes little sores on basically on the head, around the face, and in severe cases those sores extend down into the throat of the animal. Now, fowlpox is not actually a deadly disease. The mortality rate is low, but the problem is your production falls incredibly. Remember, if you've got sores down your throat, you're not going to eat. Now think the same practical way of your animals. Same thing applies. They're going to stop eating or eat much less because it hurts them. So very important note to take now is, of course, there is no fowlpox vaccine available in the country, and that is a big challenge for our poultry farmers. So what do we do in a situation like this? And the only advice is you're going to have to double down on your insect control. When I talk about insects, I'm talking about our flies and our mosquitoes. Double down on those fly catchers that you hang around your poultry houses. Spray the outsides of your house with cypermethrin or alphametrin to try and prevent as much as possible. There is no guarantee that this is going to work, but it just decreases the chances, and you're going to have to double down, unfortunately. The next disease we're looking at is a focus on our cattle, and it's not yet its time, but it's coming, it's ahead of us, and that is lumpy skin. Now, lumpy skin, the name actually says what it is. It's lumps that form all over the animal. It's sometimes about the size of a 5 rand coin, and of course those lumps are very painful for the animal. So, and in severe cases, it also goes over the udder of your cow. Now, think if the udder, that our cow's udder is covered in sores like that, and she's got a suckling calf, she's not going to feed that calf. Now, again, very important, lumpy skin, you can only prevent it by giving the animal the vaccine. So be aware of it. Get the vaccine and give it to your animals so that you're sure that you do not get an outbreak of lumpy skin, as it will affect your production of your cows. And of course, if you've got beef cattle, it can influence the quality of your carcass when you deliver them to the slaughterhouses, because they make marks on the muscle, and that causes the slaughterhouses to give you a worse grade than you actually need, and then you lose money because you get paid per kilogram. The next disease, last one that I want to touch on, affects our sheep farmers, and that's a disease we call blue tongue. Now, blue tongue, it's a little bit descriptive, but basically what it comes down to, the sheep's tongue starts to swell, and in severe cases the tongue even sticks out of the mouth, so swollen is it. Now imagine what's going to do to your animal's production. Now, blue tongue, the animal's not going to be able to eat. In severe cases, between your hoof, where your hoof joins with the body, that area gets inflamed as well, and the animal doesn't even want to walk around. So be aware of it. You have to vaccinate Again, I'm going to repeat it a lot because it's very important. That's the only way to prevent these diseases. So if you've got an outbreak of fowl pox, lumpy skin or blue tongue amongst your animals, yes, you can start an antibiotic course, but just understand that antibiotics is not going to kill the disease. The animal's immune system is going to have to do that. The antibiotics is just there to try and prevent secondary infection. Of course, all these diseases the animals can pull through. They can return back to normal production, but you're going to have a scar on basically on your production chart where you've got a severe fall. In the poultry industry with your fowl pox, you struggle really to return to your peak production. You always come in a little bit lower, even if your animals are healthy afterwards. So just be aware. Have always what we say in times like these, visit your animals as much as possible, daily, twice daily, so that you can check for symptoms. It's usually always with most diseases, it starts with a fever, but then you can look out for some of these clinical signs that I just mentioned just shortly when I explained them. So be on the lookout for them. Otherwise, just contact your nearest Alzu one-stop shop for advice, or one of your technical advisors to advise you when to apply these vaccines. Usually, just a good rule of thumb is in times like now that we have currently, it's very hot. Our flies and our mosquitoes are very busy. Now, they're not always the main carriers, but sometimes they can play a role in spreading these diseases. And that's why we're looking out for these diseases currently. But you want to vaccinate your animals when before the massive boom in population of flies and mosquitoes happen, and that's usually late winter that we want to apply these vaccines, just to make sure our animal is ready for the season coming. So keep an eye out for these diseases, and for your time tonight, thank you. I appreciate it. Till next week, same time, same place. Have a good evening.